from the CoMiSS, from the other publications, and Ivan tried to answer the question, can CoMiSS be improved? And now, whoever wants to ask a question from the audience here on site or online, please do it. We already have some questions, so I think we can start. Ivan, can we start with the first question? I will start. Could CoMiSS be used by house visitors or community nurses? Does it need any modifications for use when used by healthcare professionals?
I don't think so. You can use it interchangeably. Whoever wants to use it can. It's not a problem.
I think there's agreement among us.
Yeah. I think that was also clearly shown in the Spanish study where the CoMiSS score was given to the parents and then independently filled in by the healthcare professional, and there was no difference between that scoring at all.
Okay, thanks a lot. It was a question by Dr. Tushar Bangerie. Now another question by Dr. Isabelle Etienne. Hello and thank you for your presentation. I have only one comment. When we do a cow's milk elimination test, the items that we check to see if there are improvements are precisely those of the CoMiSS. Can you enlighten me further on the real usefulness of this score?
Yes, I think it was documented in those studies, even in those who were following the new formulas, because they were comparing the already tested and the new ones, and it was comparable with those already tested or used and those new ones, and the changes were always seen. So the elimination brings decrease in those infants who are allergic, and then followed by a food challenge, you see again decrease, but it was not tested very often.
Excellent. We have asked two questions from our online participants, and now it's time for the participants here on site. So we will start here. Yes, please.
Thank you very much, Nicolas Kalash, Lille, France. Congratulations and many thanks for a very nice presentation this morning about cow's milk allergy and CoMiSS. I have two questions. One question, during your review of the literature, did you distinguish between IgE-mediated and non-IgE-mediated cow's milk allergy and the CoMiSS test performances? This is the first question. And the second question about urticaria in non-IgE-mediated children. Always I use CoMiSS scores in my daily practice, and I have a big problem with urticaria and non-IgE-mediated cow's milk allergy, since we have a high score, and in non-IgE-mediated cow's milk allergy, urticaria is often not related. It could be related to viral infection and could be related to hypersensitivity of histamine. Could you comment? Many thanks.
I will answer the first question. When reviewing the papers, there was no difference between IgE and non-IgE mediated allergy. Some of those studies were including both groups, and it was performing very similarly regardless to IgE presentation or absence. Sorry, present or absent, sorry.
Yeah, and regarding the second question, that's why I also highlighted the history of CoMiSS, which is a combination of IgE and non-IgE mediated allergy. And that makes it somehow confusing. But now I think in the new score, it's very much highlighted that there needs to be the direct time relation between the ingestion of cow's milk as single food and the appearance of the urticaria, which makes the relation much more clear and avoids the confusion with the other causes of urticaria.
We have another question here on the left side. Oh, it's a camera. Sorry, I apologize.
The camera has no question?
I apologize.
Good morning. Thank you for the nice presentation of the speakers. But I think that many papers that have talked about concerning the elimination diet must be reviewed, because many of these infants on elimination diet were receiving cow's protein hydrolysates, and they possibly were allergic to the small oligopeptides. And I think that is a question very important. I don't know how do you think about that, but many of these infants, it's very usual, very often to find infants that once they have been put on rice hydrolysate or amino acids formulas, they improve, but not with not with the formulas, but with a small protein oligopeptides. What do you think about that?
It's a great question. I think, all of us acknowledge the fact that you have around 10% of children on an extensively hydrolyzed formula, whether that's casein or whey, due to the residue of beta-lactoglobulin, that you may continue to react and respond. I think in relation to CoMiSS, I think CoMiSS is a very useful tool to assess your success of your dietary elimination. And from the studies that have been published, as Katerina said, we've seen a very nice association with a reduction of the score with the elimination and the reintroduction. I think initially it was used also to assess, within formula changes, the success. I think to your question around the specificities, whether you use hydrolyzed rice formula or amino acid formula, I think there's a little bit more data that is required around, specifically around rice formula with CoMiSS, but I think it's a really good point that you're making, so thank you for the question.
Any more questions from the audience? No, so we have some questions here. Can parents reliably use CoMiSS?
Yes, no problem.
Okay. And the next question is, what
Can I just, was saying, whilst parents can reliably use CoMiSS, I think what we really as a group do want is that the healthcare professional is involved and that it's an awareness tool, and that we still as healthcare professionals apply our clinical assessments and our assessment of the child as well. As Ivan has highlighted and Katerina has highlighted, we do need to be thinking about differential diagnosis. So whilst it's easy to be used, we do want healthcare professionals to be involved.
There's another question, and perhaps Katarzyna can answer it. Did you measure IgE against cow's milk in these patients with no symptoms and high CoMiSS above 12, at least based on the literature? Can you answer it?
No, I think there were not, those infants were not assessed regarding to IgE levels. They were just clinically assessed, and that was the result. I think it was not required in the protocol.
But they had a positive challenge test, so all those children were diagnosed with cow's milk allergy, the classic way, elimination diet and challenge test.
We have another question. What does a score between 6 and 10 indicate?
Wait and see.
Any other questions from the audience? I cannot see. What are the next steps in the CoMiSS experts group now that CoMiSS is updated? Katarzyna.
I think we should probably ask our head.
Well, I think the first priority research is to have the normal data, as was highlighted by Katerina also, in the age groups between 6 and 12 months, and to have a normal score or a score also in healthy infants outside Europe, because up to now the normal range and everything has been performed only in European countries. And we should at least confirm that if you go outside Europe, your cutoff remains the same.
And it's probably on occasion to invite others to
Absolutely.
do this
So
kind
that's
of
why
studies. Yeah.
I would
Because
say
it would be really great to have like a geographic representation and much more data that we have at the moment. Okay, any other questions? There are no more questions. There are some questions in the... Yes, there is. Oh, sorry, I apologize. And you are not a cameraman.
Hello, hi, good morning. Thank you for a very nice presentation by everyone. So I'm Shariar from UK. Question specifically for Rosenmeyer, but it can be for everyone. So what we are anecdotally seeing, in our gastro and our general pediatric practices, that we are seeing probably a lot more diagnosis from our GP colleagues with regards to cow's milk allergy. So do we have any sort of population-based data specifically in the UK, as to whether the incidence and prevalence of cow's milk allergy is increasing or whether it's being recognized and diagnosed more. So just something to take from this meeting.
We don't have a more recent prevalence study in terms of cow's milk allergy, recent, within the UK. We do have the data, of course, on the prescribing of the formulas. And that has, based on the prescription of the thin database for more than, if you use it as a proxy and you eliminate all of those that have chronic conditions, and you say those that received a formula for more than 3 months, you assume that it's for a cow's milk allergy when you've excluded. So you can see an increase from that perspective, certainly in terms of our prescription. And I think that's a concern. Europreval from 2015, whilst we had the highest at 1.3% in terms of cow's milk allergy, that's the last prevalence study, our prescriptions indicate that based on the prescriptions, it seems much higher. I think we do have a problem for prescribing, but I think that's also a problem with the system itself, because you only have 10 minutes within a GP consultation, and it's an easy situation to make a quick diagnosis and do a prescription rather than do a very detailed, assessment. So I think that certainly is something that we need to look at, but based on the prescription, I don't think that reflects our level of cow's milk allergy. I would say to you that it is between 1.3 and 2%, something like that, but that more is prescribed. I concur with you.
Can I ask a follow-up question? So a follow-up question, just, like a personal comment from your side. Do you think that the CoMiSS score, if we hand this over to the GPs, will this, even further increase the prescribing of those formulas, or, just your personal comment?
We don't have the data, so that data needs to be created. My personal opinion is it's most probably there will be, many of the GPs may be quite grateful that there is something extremely simple and quick. The data that we found was that there was poor knowledge and also of what is out there to support the diagnosis. But I think one of the biggest problems that we have is because of the tightness of the system, so stretched, is to bring them back and re-challenge. So we often find that process has not occurred because it's so much easier to kind of continue prescribing, or the knowledge, especially if there's IgE-mediated allergy, to get into a service to do a supervised oral food challenge doesn't exist. So I think a tool is only as good as following the diagnostic process, and part of that diagnostic process is the oral food challenge, and that's where our problem lies.
Thank you.
One question was to repeat the scoring criteria, but if you go to the QR code, you get the scoring criteria. So because with this, I think we have come to the end of this these presentations, of the symposium, and I would like to thank Professor Sajewska for sharing in an excellent way this symposium, and I would like to thank my co-speakers.
And perhaps we should repeat some of the take-home messages.
Yeah, absolutely. If we still have time for it.
Yes. I would like to repeat, first of all, to thank the presenters, that the CoMiSS awareness tools has been well studied and may improve the cow's milk allergy journey from symptom presentation to diagnosis for both patient and healthcare professionals. This comes very clearly from the Rosanne's presentation. Katarzyna presented that CoMiSS is an easy-to-use practical awareness tool for evaluating cow's milk-related symptoms, but cannot be considered as a standalone diagnostic tool for cow's milk allergy, and we repeat it again and again. And finally, Ivan presented that Bristol stool scale and Brussels infant stool scale can be used interchangeably, that the CoMiSS is an awareness tool for evaluating cow's milk-related symptoms in other ways healthy infants less than 6 months of age. Probably extendable to 12 months, but we need more data. And last but not least, a cutoff score of 10 or more may be suggestive of cow's milk allergy. And with those take-home messages, we once again thank you very much for your participation in this meeting. And once again, QR score allows you to go to all the materials from the session. Ivan, there is still something
And
to be added.
a very final comment, if some of you want to join us and provide us with data outside Europe or in infants between 6 and 12 months, please contact us. You're more than welcome. Thank you.
Thanks a lot. Thank you very much. Thank you.